Hello, welcome to the Langford Academy. I'm Steph, the dermatologist at Langford Referrals, and this is the third part in the Vet How To series looking at cytology. In the first two videos, we looked at an introduction, and then there was the practical video that talked about how to take the samples. In this video, we're going to do a recap on how you take them in case you missed the last one or need a little refresher, and we're going to think about what we're looking for and why we might be taking these samples. So the first one we're going to look at is a coat brushing. So a coat brushing is a really simple and easy one that we can do in many of our patients. Just as a little recap, we're going to use ideally a flea comb or some other comb that you find, or even a brush if you were really desperate. And we're literally just going to brush or comb the animal, typically over the dorsum, but we will sometimes find fleas around the neck, so don't forget some of these areas. You can look on the comb itself to see if you've picked up flea darts or live fleas, which you sometimes will. You can also use a piece of wet paper or white paper towel, and if you transfer the material from the coat brushing onto that, any flea darts will turn red, and that's because they're digested blood. So that's a really easy tool. I have previously been referred a dog with fleas. It's only happened once, but it's a really easy thing that we can rule out in the consult. And as it says on the slide, we're literally just looking for fleas here. So we're not going to pick up other parasites such as Demodex or Sarcoptes just doing this. This is just a surface test. And I guess cases where we'd be looking for fleas would be patients with pruritus, cats with miliary dermatitis. We can see miliary dermatitis with any of our allergic presentations in cats, so also cats with food allergies and cats with environmental allergies. But certainly if we had a cat with miliary dermatitis, I would want to be combing the back. A dog that's itchy, a dog that's perhaps having hair loss or scabs over the back. Of course, this could just be a folliculitis or a superficial pyoderma, but ruling out fleas is going to be really important. And I would urge you to still do a coat brushing even if this patient is on parasite treatment, because we can have hitchhiker fleas that might be jumping on and causing a problem, where the flea gets on the animal, will be killed once they bite the animal, but if this is an animal with a flea allergy, for example, could still be causing clinical signs. The next technique we're going to look at is hair plucks. So just as a little recap then, a hair pluck, we're going to use a small pair of forceps, or your fingers if you can't find forceps, but it will be easier to get a bigger sample with a forcep. We're going to place a drop of paraffin onto a slide. We're going to take the forceps or our fingers, and we're going to grasp the hair and firmly tug to remove a small sample. Obviously, we don't want to be taking a huge chunk that's going to be uncomfortable for the animal, so a reasonably small sample. And you want to be taking the sample from affected areas, so you may need to take more than one. We're then going to lay the hair onto the slide, making sure that the hairs are all going in the same direction, and we can then assess under the microscope under low power. And what are we looking for? Several things actually on a hair pluck. Parasites. So, I mean, lice are really unlikely to be found in small animals, but theoretically you could see eggs stuck to hairs. That's not really a small animal problem though we're going to be thinking about. We're looking for parasites, so Demodex you can find on a hair pluck. If you don't find Demodex, it doesn't mean that it's not there, but it's a really nice, easy test we can do to look for them. Broken hairs. Now this is particularly useful with cats where they're much more secretive with their itch. They may be grooming or scratching where the owners can't see them. So the owners may be saying they're losing hair, but they're not seeing any signs of itch. If we do a hair pluck and there are a lot of broken hairs, that would confirm that this animal is itching. So either licking, barbering, so chewing at the hairs, or scratching. That's really helpful to know. We can look at our hair follicles. So we should normally see a mixture of anagen and telogen hairs, anagen being the growing phase. If we have a dog that's losing hair or a cat, and we find that all of the follicles are in the non-growing phase, that's useful to know, and there are a variety of reasons why that can happen. Similarly, dilute colours, we see quite a lot of those these days, so probably the most common example now would be a blue whippet. If we think about putting some white paint into black paint, you'd get a dilute grey colour, and that's what's happening with these dilute colours. So our blue whippets, we see these kind of blue dappley dachshunds quite a lot. Bulldogs, we're starting to see dilute colours. The classic would be a fawn Doberman, but actually we don't see those that often. So if we've got a dilute coloured dog that is losing hair, colour dilute alopecia is absolutely one of our differentials. And you would be able to look for signs of that on a hair pluck. So let's now go through and look at our different samples and what we're looking for. Okay, so we mentioned the hair growth cycle. We've got some nice images here of a telogen hair and an anagen hair. We can see how the telogen follicle is pointy, a bit like a little, like a spear, I guess, or a little arrow, whereas the anagen is rounded more like a golf club. They're quite easy to tell apart, and in a normal animal you would have a mixture of both. So you'd have some hair follicles that were in the growing phase and some that were in the non-growing phase. But if all of the hairs were in the telogen, that just tells us that something has interrupted this cycling, and that can be a variety of reasons, but that's really useful to know. So we talked about broken or fractured hairs. We can see very clearly here that these hairs do not end in a nice point, they end very abruptly. And as I mentioned already, that would confirm that we've got an animal who is licking, scratching, biting, and that's generally associated with pruritus. So this is very useful for owners who aren't sure or don't think their dog or cat is itchy. So colour dilute alopecia I mentioned as well. What we can see here is macromelanosomes, so clumping of melanin. This is what we'd find in a dilute hair. Now this doesn't mean that the patient is going to go on and get colour dilute alopecia, but these hair shafts are more prone to becoming dysplastic and fracturing, and that's when we then get the alopecia. These patients are also quite prone to folliculitis, and we don't really know why, but certainly if you've got a dog who is losing hair and you're not sure if they're a dilute colour. For example, I recently saw a black Labradoodle who was actually quite silvery when he came in, but his owner said no, he was black originally. And when we looked at his hairs, there was no evidence of him being a dilute breed. So that's where it's really useful. If you've got a dog, you're not sure if this is colour dilute alopecia or not, and you see, as in this slide, that there are these clumping macromelanosomes and there's broken hairs, that would be very suspicious. And then parasites, we've got some lovely Demodex here. We'll talk about skin scrapes in a minute. I don't skin scrape that many patients at the moment, and I'll talk about why, but certainly a hair pluck can be very helpful to look for Demodex, as we can see there. Okay, so skin scrapes now. Let's talk a little bit about why we would take skin scrapes and just remind ourselves how to take this sample. So, as we talked about in the previous video where we went through the steps, just as a quick recap, we're going to have a 10 blade, so the big fat scalpel blade. We need a slide and a little bit of paraffin. We're going to squeeze the skin. This is because if we're primarily looking for parasites here, we want to squeeze them up to the surface. And then we're going to scrape the skin gently in the direction of the hair. So we're going to do a little scrape, we're going to squeeze, a little scrape, squeeze, and we repeat until we get capillary ooze. So what we're creating is a little graze on the skin. We want to see a little bit of bleeding. Generally this is well tolerated. I always warn owners that we are going to make a little bit of bleeding, not a lot, just like a graze. And then we're going to assess this under the microscope on low power. Again, no staining. We're predominantly looking for parasites here. We'll have a look at some slides in a moment, but I mentioned a second ago that I don't do that many skin scrapes for a couple of reasons. Most of the patients I see have already had really rigorous cover with an isoxazolone parasite treatment. Now this does not rule out parasites definitely. I have had one case who had negative skin scrapes. We biopsied him. He was up to date with NexGard Spectra and we found Demodex. And this was just a complicated case with a lot going on. But the reason I don't always skin scrape them is if actually there are perhaps limited clinical signs that make me suspicious of parasites. They're up to date with parasite therapy and have always been, so the clinical signs started, but the flea treatment predated that. And perhaps they're a dog with quite sore skin anyway. I find that all we do is scraping is make another kind of focal sore area that they then tend to bother at. And for many cases of Demodex, we can find them on a hair pluck. Sarcoptes or notoedries in cats would be the exception where actually we do need to scrape. But I had another interesting case recently where he was intensely itchy and showing signs of hair loss, and he wasn't up to date with parasite therapy. His owner elected to take quite a step-by-step route, so we gave him a Brevecto. Obviously other brands are available, but we treated him with an isoxazoline. We used topical antiseptics, and he had already had a sight point from his vet for anti-itch, and we elected to just review in 2 to 3 weeks, and he made a dramatic recovery. Interestingly though, he'd had skin scrapes with his vets. I did hair plucks and skin scrapes and didn't find any parasites. But his dramatic response just essentially to parasite therapy confirms for me that I suspect this dog had probably Sarcoptes based on his level of itch. So we can't always rely on finding them even when we scrape them. So if I've got a dog who I'm extremely suspicious may have parasites, particularly Sarcoptes, so I'm thinking these very, very itchy dogs, I will skin scrape them. But those I would say are probably the only cases. I'm doing a lot more hair plucks than skin scrapes, particularly if I'm looking for Demodex. So I guess the take home there is assess it on a case by case. If you're not sure if you need a skin scrape, it's not going to hurt the animal to do one, but just assessing a little bit, what am I actually looking for? And if it's not a burrowing mite, do I need to do one? So just something to think about. Okay, and then we talked about these parasites already. We've got a lovely Sarcoptes mite here on the left. I've never ever found a Sarcoptes on Cytology. They're quite hard to find. Just because you don't find one doesn't mean they're not there. As the previous case I talked about, sometimes response to treatment is really telling. And then Demodex as well. Again, sometimes you have to biopsy to find the Demodex. So I've had, again, cases where we've skin scraped and hair plucked. That one I mentioned who was on parasite therapy, and we found the Demodex on biopsy. So these parasites are a little bit pesky. Importantly, you can't rule them out if you don't find them on Cytology, but it's still worth looking for them, because if you do find a Demodex or a Sarcoptes, that's great, and then that's really diagnostic. So definitely take your samples. But I guess particularly with skin scrapes, just think about which dogs we're sampling. Fine, so impression smears and tape strips now. Just as a little recap, these techniques are looking for surface or superficial bacteria. For sellotape, I'm generally looking at dry lesions, so epidermal collarettes, red inflamed skin. I quite often do sellotape from axilla, ventrum, in between foot pads or toes. Direct impression smears are for moist lesions. So a really good example is a cat with head and neck pruritus that has given themselves a big wound on their neck. Great case to do an impression smear on. If you've got an erosion or an ulcer, that's a lesion you want to do an impression smear on. The rest of the skin, I would say I do a lot more sellotape than I do impression smears. You can swab the skin, but often sellotape I find gives you a better yield if you prepare the sample properly. So just on that note, the most important thing with sellotape is not to put it into the fixative. It happens a lot. It's not a disaster, but what will happen if the patient has already gone away is then you've lost that sample. So if the patient is still in the consulting room, you can go and get another sample, it's not a problem, but just remember it will melt the sellotape. I think it's the fixative that, the adhesive that doesn't like the fixative. So it is really problematic if you put it in the fixative. We are looking at these under high power. So the other samples so far we've been looking at just under the first 2 lenses. With these we will need to go up to our ×40 and then our 100 oil. And we're looking for inflammatory cells, red blood cells, bacteria, so cocci and or rods, and yeast, so commonly Malassezia. And these cases I think are quite self-explanatory. Most cases I would say benefit from some kind of surface cytology. So any animals with red skin that's inflamed in their armpits, their groin, their feet, their lip folds, their back, if you've got a folliculitis, anywhere where you want to know, is there an increase in yeast and bacteria here, do surface cytology. And then many of you might have seen these slides before if you've seen my ear series already, but these are just going to break down some of the common things we find. And this is one that I find catches people out a lot, and that's the difference between melanin and cocci. So we can see there with the white arrows we've got melanin. They're smaller and they don't take up the dye. The cocci are a little bit bigger and do take up the dye. And so now you can see them at the same time, they're quite clear and kind of easy to distinguish. But just remember, because if you were seeing the melanin on its own, it would be really easy to confuse it with cocci, and that could really change how you're treating. Malassezia then, we're all very familiar with these cheesy smelling dogs, easy to find on Cytology. We've got some lovely peanut shaped Cytology there. They're not always budding, so they may look a little rounder and not have that characteristic kind of waist or snowman appearance, but they should take up the stain really nicely. You'll find the odd one on normal skin, so if you find a couple, that's fine. But if you're finding usually more than 5 per high-powered field, we consider excessive, particularly if there's also inflammatory cells or the dog is very clinical, that's then significant. Just a small slide on cocci versus Malassezia. When you see them together, the size difference is really big, but if you were seeing one on isolation, you'd be forgiven for mistaking the two, particularly if you haven't looked at a lot of Cytology, so we can see there nicely the difference. And neutrophils, there's also some rods floating around there. They don't always look beautiful. These are very nice neutrophils, but they can become quite degenerate. Depending on how you prepare the slide, they can be streaking as well if you squash them, but there we go, just something to look out for. And then rods versus cocci. I would say the main time these are difficult to distinguish between is when you have a couple of cocci stuck together and it's hard perhaps on a low powered microscope to know whether it's a rod or a couple of cocci. This is where using your fine focus is really helpful to go back and forth through the different layers, and you're looking to see, is there a waist? Can you see any distinction between the two cocci, or is this a uniform rod? If you look at enough, you'll start to get your eye in and notice the difference, but it can be very tricky, particularly if the microscope isn't quite as good. And that's all for today. So that's the final video in our how-to series on cytology. Please do subscribe to the Langford Academy. We've got lots more great videos coming out soon. I'm Steph, the dermatologist at Langford. Thank you so much for listening, everyone.